Thank you. Yes, I am the representative of state government. I'm very grateful to be here. I just want to say how encouraging it is to all of us across the country to have the Congressional Addictions Forum and all the leadership that's being provided around CARA and other legislation is kind of a breath of fresh air. Finding champions around this issue has been difficult and is not always available, and this is one of the best opportunities we've had. So I'm grateful for that, and I'm also thankful for the opportunity to be here. I'm going to just describe a little bit about what the public system tries to do to address the issues of prevention, treatment, and recovery for people seeking long-term recovery, for families, and for the institutions that government tries to support. Thank you for the NAZADAD reference. Rob Morrison is here. Some of our NAZADAD staff are here. We have a couple of handouts out on the table about the issues that we advocate for here in Washington that states need. And of course, when we are representing state government, we're also representing our governors. And governors are very involved right now. I think the prescription drug problem has mobilized government across the nation. So again, this is one of those rare opportunities to actually make something happen that we've been all wanting for a long time. So just in North Carolina, we have about 45,000 youth who meet the criteria for needing treatment. And just as everybody has said, we have about 3,000 in treatment in a given year. So that's about a little less than 8%. That is terrible. That is the problem you just spoke to, that there are children who everybody knows need treatment, all the systems that they interface with know they need it, but getting access has been a problem. The way a state goes about putting a system together, especially one that is heavily loaded toward adult treatment because of the public safety issues that are associated with it, is very difficult. So we have a little bit of the block grant, which is very important, and then a state like North Carolina has to seek grants from discretionary portfolios of the different federal, state agencies and foundations to put something together to try to make it work. And there are a couple of problems with that. One is sustainability, how you keep something going, and the other is it never goes to scale. As Mark said, taking things to scale is a huge problem in the United States for children and young adults. Well, one of the things we did several years ago was when I first came to the state office is we developed a network of small residential programs. And we had all kind of problems with licensure and all the rules that you have to put these together, but we did it. We partnered with the Department of Public Instruction, so we have a school in each of these centers, and they're like 10-bed units, little tiny units, but with a full school, because what we realized right away is that kids that were being identified for treatment, meaning they didn't want them in the school anymore, they were already performing well below grade level, which was all part of the syndrome, part of the problem. And these schools have been so successful that we bring kids up in about 3 months, almost back to grade level, and try to get them back into school. Because if they can successfully graduate from high school, we have made a huge contribution for them and for their communities. But you've heard the problem of getting kids back in school. They often can't not go back to their own school. You have to have a recovery support program of some kind, and they don't exist. And so we've tried to put them together. We are very excited that we recently have 6 new Collegiate Wellness Recovery Centers in North Carolina. We're paying for them with the block grant. Our governor said, let's do this. We need to change this, and we picked 6 colleges and universities in the North Carolina system, and we're encouraging some of our private colleges and universities who are a little bit better endowed to do the same thing, and we're putting together a network of those recovery centers. Another thing that we have done in partnership is one of my themes. States particularly cannot do anything without all the partners that are here in this room. CADCA is one of our partners on our coalition, NIDA, NIAAA, on helping us learn better practices. The NGA is a more recent partner on prescription drug use. I don't want to forget anybody. Of course, SAMHSA, who is really important to what we do, and ONDCP. You've heard that when kids are falling out of the regular community system and the school system, the system that picks them up is the juvenile justice system, and so that is one of our major partnerships. We have a whole team in our office that is called Justice Innovations Team. All they do is work on the interface for children and adults with the courts, the correction system, the community correction system, and jails, to try to make sure we are intercepting people wherever we can who might be able to take advantage of treatment. And so we have teams all across the state that are for juvenile justice that are made up of the judge, the court counselors, the local providers, families, local law enforcement, to organize services around young people. This past year, they told me to say this, we had a big training with 120 juvenile court judges and prosecutors just to talk about this issue and how we might do a better job of giving kids and young people the opportunity to access treatment and recovery. And then my last one is our new prescription drug prevention program that is both being led by our governor, assisted by the National Governors Association, and a Center for Substance Abuse Prevention grant, Partnerships for Success, where we're targeting communities with the highest death rates. We had 13 communities. Again, it's wonderful. We love it. We're including our coalitions, our primary care practitioners, but it's only 13 of our 100 counties. And all of our counties face this challenge. So taking it to scale will again be a challenge. Want to point out a couple more resources that NASDAD makes available. One is we have a new guide for adolescent treatment. It's on our webpage. All the adolescent coordinators from across the states worked on it for over a year to develop it. And it gives some good resources for people who are looking to build a improved system. I think that's what I have to say. Again, I just want to say that it takes all of us working together to make this happen, and we've never been this close before, so this might be the time to do it. Thanks.